President, distinguished colleagues, I rise to lead the debate on the National Health Act Amendment Bill 2025, SB 886. Your Excellencies, this is a bill that seeks to amend number 8 of 2014 to increase the basic health contribution fund from 1% to 2% of the consolidated revenue fund of the federal government. Please recall that the bill was read for the first time in this hallowed chamber on the 9th day of July 2025. Mr. President, my distinguished colleagues, this bill is firmly rooted in the Constitution of the Federal Republic of Nigeria, 1999 as amended, Section 14.
Deputy Senate President.
2.
DSP, please approach the chair.
Which provides that the security and welfare of the people shall be the primary purpose of government. Furthermore, item 17(3)(d) of the concurrent legislative list, part 2, second schedule, mandates all levels of government to ensure adequate medical and health facilities for all persons. By strengthening the Basic Health Care Provision Fund, this amendment directly advances these constitutional obligations. It is therefore both a legal and moral imperative. Your Excellency, Mr. President, my distinguished colleagues, the Basic Health Care Provision Fund was established under Section 2 of the National Health Act 2024 to provide a guaranteed minimum package of health services for all Nigerians. It represents Nigeria's first statutory mechanism for sustaining health financing. However, with increasing service demand, stagnating donor assistance, and persistently high out-of-pocket expenditure, now over 75% of total health expenditure, according to the National Health Account of 2022. The 1% allocation has proven insufficient to meet national health needs. Recent fiscal threats further underscore this concern. The withdrawal of the US government's support in key health programs and Nigeria's approaching transition from Gavi, the vaccine alliance, mean that the country will soon shoulder greater financial responsibility for immunization, maternal health, and disease control. Without an increase in domestic financing, these developments could erode the hard-won gains in child survival, epidemic preparedness, and universal access to basic health care. Therefore, increasing the Basic Health Care Provision Fund from 1% to 2% of the Consolidated Revenue Fund is a strategic and timely intervention.
Very important, very, very critical to our development. This will enhance our primary health care system, encourage universal health coverage. Mr. President, health is too serious to be left to Nigerians, especially in the face of poverty. In a lot of the developed and developing world, especially the developed world, I know in Canada, healthcare is essentially a government thing. You hardly find private hospitals. That shows you that this sector, this area, is too important to be left to the individuals, especially in poor countries like Nigeria. Mr. President, today we have a situation where citizens and our constituents resort to quacks, resort to prayer houses. Mr. President, I want to also say clearly that I believe in the efficacy of prayers. But in what is happening today, our people are driven out of poverty to these prayer houses in issues that can be handled, especially at the primary health care level. Mr. President, I support this bill, and I also want my colleagues, urge my colleagues to support the second reading of this bill, so that Nigerians will have access to health insurance. Mr. President, I believe that for the healthcare system to be effectively enhanced, there must be a resort to health insurance. And our people must also have the benefit of federal government health programs to address health issues.
President of the Senate, very distinguished colleagues, I am Issa Jibrin, representing the very good people of Kogi East. Your Excellency, I rise to wholeheartedly support this bill, ably moved by the Chairman Senate Committee on Health. I will call this a call for timely intervention in the health sector. I also believe that the revival of the health sector is one of the core spindles around which the renewed hope agenda revolves. Mr. President, basic health is very key because it addresses issues of, in particular, children and women, such that when those problems are resolved timely, at a future point in time, there won't be any form of medical complications for our children and our women. For the children in particular, when they are growing up. Your Excellency, given the rate of inflation in Nigeria today, the purchasing powers of average Nigerian has dwindled. So many Nigerians, like mentioned earlier, have resorted to local herbs because they can no longer afford basic health facilities. So I believe that this bill is timely, more so as donor agencies are not forthcoming because of what I'll call a fairly strained relationship between Nigeria and some of these countries where we get our donors. The donor agencies are no longer forthcoming. I feel that at the end of the day, we need to adequately prepare our children and women from the basic essentials so that they don't grow up having complicated health issues.
The chairman of Health Committee is not asking for more money. What he's asking for, really, is that greater attention should be given to preventive aspect of our health system. And like he rightly couched it, he said, this is where mothers give birth, children are humanized, and diseases are detected at an early time. My feel is that if we take care of preventive aspects of our health system, we spend less money on the curative side. If we take care of the preventive side of our health system, what it means is that our population will be healthier and their productivity or contribution to economic prosperity will be greater. So I stand to support full-heartedly that this bill should quickly be read the second time.
An act to amend the National Health Act number 8, 2014 to increase the basic health care provision fund from 1% to 2% of the consolidated revenue fund and for related matters 2025, second reading taken. This bill is referred to the Committee on Health, Secondary and Tertiary to report back to the Senate within 4 weeks.